I think I'm going to have to use my phone. Let me see if is my picture coming up?
Yes.
Yep, I see you. Andrea?
Okay, good. Okay, thank you.
Okay. Oh, Amanda, are you there?
Yes. Hi, Councilman Adams.
Yeah, hey, could we tell the people that we're waiting on a quorum?
I suppose we can do that. Give me 1 second.
Sure.
Today is the inaugural weekend of Velshi Across America 2020. I have traveled to a different battleground state for each of the remaining 8 Sundays leading up to the election, and speaking with small groups of
WITN here. We're just waiting for a quorum.
Hi, everyone. This is WITN. We now have a quorum, so just give us 1 second to go live to TV and then we can begin the meeting.
Mr. Chair, you may begin.
Okay, you can begin. Thank you. Good afternoon, everyone. This is the meeting of the Health, Aging, and Disabilities Committee. I apologize for the lateness here till we were able to assemble a quorum, which we now have. I'd like to welcome everyone out there who's listening to us or watching us on Zoom. And at this time, if I could ask my fellow Conrads to introduce themselves so we can start this meeting.
Good evening, Hanifa Shabazz, President, City Council.
Councilman Vaz Turner, 5th District.
Good evening, Chris Johnson, 7th District.
Thank you, everyone. We're also joined by Councilman Guy and also some of the City Council staff with us. We have one item on the agenda this evening, and that is for us to discuss an amendment to ordinance 20 for us to discuss ordinance 20-042, which amends chapter 40 of the city code. At this time, this legislation is sponsored by Councilman Guy, and I would like him to take the floor so he can discuss his ordinance. Thank you, Mr.
Okay.
Guy.
All right. Thank you. What this does is this establishes OSHA level protection within the city of Wilmington for city of Wilmington employees. That's the essence of what it does. And it places the responsibility for that aspect of city government in the personnel department, which is basically where it's been when it was first put in place. What it does is it gets rid of the City Occupational Safety and Health Committee. That's a committee really that doesn't function in any kind of significant way. And it's really not necessary because OSHA standards are pretty clearly established by the federal government. And so there's really not a whole lot new when it comes to identifying what the standards are. Generally, what we have is in America, OSHA applies to the private sector, generally speaking. And when it comes to the public sector, there's certain circumstances that basically result in Delaware being a state that has not established OSHA level protection for state of Delaware public employees. They've chosen not to do it. It's been an issue that's been on the table for seems like over 20 or 30 years, but it has not been put in place. But it was put in place for City of Wilmington employees. So City of Wilmington employees were basically the only employees, public sector employees in the state of Delaware that had OSHA level protection going back some 20 years or more. And so this returns the body of law to what it was originally. Apparently, over time, there were some folks who wanted to try this committee out. And it really doesn't appear as if there's really any record of this committee doing anything of significance. So that's basically the essence of it, to provide OSHA level protection for City of Wilmington employees. So for example, when all this COVID stuff came out, with OSHA level protection, you basically just follow what the federal government establishes as the appropriate level of protection for City of Wilmington workers. That's all I have. Thank you.
Thank you, Mr. Guy. I guess as the chair of the committee, I get to speak first here. I just have two really quick questions for you. One is I am really happy to see that you're writing in this ordinance, proposed ordinances, to say that the Wilmington standards will be identical to the federal standards. Quite often we have different regulations at different levels, which makes it quite complicated for businesses. And I'm glad to see that we're applying the same standards here, in this case, to the Wilmington government. Could you speak more, though, to your second part, where there will be established a personnel department, actually, I guess, an OSHA administrator or enforcement officer?
Okay. So basically, whenever something of this nature comes up, it has to be housed somewhere. And so if you look at the areas that were struck, A, B, and C, you can pretty much see that the personnel department has been the entity where this was kind of put into the structure of city government, if you will. So it's really not a major, it's not really a major change. If you look in paragraph C, which has been stricken, preparation of the city OSHA plan shall be the responsibility of the city OSHA committee. So instead of there being some committee that varies from time to time, etc., because it's identical law, it just really needs somebody who's responsible for making sure that we do the things that we're supposed to do. So that would be the personnel department, and it just is given a name. It could have just been the personnel department director, but often it's worthwhile for there to be like an entity established.
Understood, Mr. Guy. Thank you. So we're having an individual who works for the city that's in the personnel department that's going to enforce the federal laws to assure that the federal laws are being followed by the city. So we have somebody in the city monitoring the city is what you're proposing here.
Well, no, I'm not proposing that we hire anybody, etc. What this is basically saying is personnel is supposed to be handling this anyway. So they distribute their assignments as they see fit. as it says, it's the responsibility of the OSHA committee. Okay, well, there really isn't a committee. And it says the personnel department shall coordinate with the OSHA committee. And in reality, you know, there really is no OSHA committee. So the personnel department kind of would coordinate with itself and its members and with the employees in the city, where if issues came up as to what the appropriate standard for something is, everybody knows where to look. There's a common place to look. And if there's any kind of enforcement related issues, like when this COVID thing came up, well, the personnel department would have been the one that probably would have taken the lead in light of the federal standards if these had been in place, and they would have taken the lead to make sure that what we're doing is identical to what the federal government has promulgated as what's appropriate in light of COVID for the various types of employees we have in the city.
Got it. Thank you for your explanation, Mr. Guy. Before I go to my comrades here, we do have a gentleman from the city, Mr. Battaglia, Bruno Battaglia, is here to speak in support or of your ordinance here, or what role are you playing this evening, Mr. Battaglia?
Zero, what I wanted to do is explain basically what the city is doing already. My title is the Occupational Health and Safety Program Manager for the city. So as Mr. Guy has alluded to, we have, especially when I came on back in 2009, we were getting together as a committee with Local 320 and 1102 and some of the department heads. Somehow we were not able to get a quorum most of the time for those meetings. So what we agreed to do amongst the departments and amongst the 1102 and 320 is that when there was an issue, it would initially be brought up to the supervisor. If they couldn't resolve it, then I would be contacted as the HR representative. And then we would come out and attempt to rectify the issue. I can tell you, since I've been here since 2009, we follow to a T all federal guidelines. Recently with COVID, one of the things we did is we conversed with CDC and the Department of Public Health, and we instituted our guidelines based on the CDC and on the Department of Public Health for the state of Delaware, bringing our employees back, what our employees were doing. At the time, it was a very liquid situation where it was just changing. It was evolving all the time. 1 week we were given information, and then the next week we're given additional information. And then even the third week we were given additional information. But I can tell you that we are still continually following CDC, for COVID now speaking, CDC and DPH. Initially, when I came on too, many of our supervisors were unaware that we were following the federal OSHA guidelines. And I came and I informed them and said, look, you know, you are right that we cannot be fined under OSHA, but we are definitely following all the OSHA guidelines. Specifically, I want to talk about one time we had some of our workers out there were cutting concrete, and OSHA came out and shut down the private industry. And for some reason, our workers kept working, thinking they could work. Obviously, I got the call. We went out and we made them aware if the private contractors were not out there with a wet saw and with the proper protection, we should not be out there, and we shut them down immediately. So, Mr. Guy, I do agree with you. It is very concerning that we make sure that we follow and we protect our employees to the utmost, make sure they have all the proper personal protective gear, make sure that we also, any way we can protect our employees by engineering out so we don't need the PPEs is the ideal, but if we can't, we do the PPEs. I'm not sure everything that's mentioned is stuff that we're doing. So, and now that you're saying that it's really not going to change anything in the committee and now it's going to be housed in HR, it seems like we're meeting all those demands. And again, I have a very good working relationship with 1102 and 320. They constantly call me if there's an issue. And then if we are not meeting OSHA standards, we make sure that we are meeting OSHA standards, and we will continue to meet federal OSHA standards.
Great, thank you, Mr. Victaglia. So I imagine what the second paragraph of this, then basically it dissolves the committee and then in essence, I guess, appoints you as the Occupational Safety and Health Administration at this time. You would be that point person who's specifically addressed in title here under B. Is that your expectations, Mr. Guy?
Well, I wouldn't make it personal to Mr. Battaglia. What I would do is I would say that what this legislation does is it actually places the responsibility for the administration and enforcement within the personnel department. That's what it does specifically. So that there's no gray areas about what a committee is doing or what it isn't doing. And with that responsibility, the personnel director would probably, my guess is, would have Mr. Battaglia handle this. But there would actually be the authority in the code for the administration and enforcement with the personnel department and whoever they delegated it to within the personnel department. All of the interaction with city employees and organized labor members, all of those are expected. I was the person who put this body of law in the first place. There was no OSHA level protection until I put this in place. But what I've observed and based on what I've read, the change with this committee is not, as I see it, a good way to kind of have a gray area, if you will. This thing needs to be clearly within the, I guess, the domain for purposes of administration and enforcement in the executive branch personnel department, and they can delegate it to him or whoever they choose to. And all of those other interactions with employees, with organized labor, et cetera, because this was, when it was first put in place, it was designed to protect our workers, some of whom are members of organized labor. So that's kind of my explanation as to what's going on here.
Thank you, Mr. Guy. And Mr. Battaglia, from what I understand from what he said is that all we're doing is putting in black and white in this ordinance the rules that he currently follows. And you do make specific reference to federal standards in here.
There's one thing I want to add. I sent something over to Marshall earlier, and it came from the law department. It was under the last item, are you able to anticipate any issues? And just want to make sure that we point this out. From the law standpoint, it doesn't look like this ordinance would seek to applicable under such as federal monitoring and reporting requirements. So obviously we would follow all the general industry standards that the city has, that a general industry would have to follow for their workplaces, but not the federal monitoring and reporting requirements. Is that right, Mr. Guy, I'm assuming?
That would be accurate for the same reason that they shut down the private sector workers,
Okay.
but the government workers kept working. This is our self-imposed standards.
Okay.
For occupational safety and health for our workers, self-imposed. And so the point that you made would be accurate given that this is self-imposed standards.
Okay, that's great. Thank you, sir.
Sounds like an ideal situation, Mr. Battaglia. You got to follow the rules, but not necessarily have to do the paperwork. So that's a good thing.
Well, the biggest thing is that no punitive damages, but we should be following and protecting our employees at all costs and making sure they're safe at all times. And I am a big proponent, just like Mr. Guy is, of that.
Yes, and I didn't necessarily want to get into the punitive part, but since you brought that up, I'll ask Mr. Guy, is that punitive part covered under, I guess, US Code 651 and sequence?
No, this is not, this legislation was never designed to be punitive. What it was designed to be was proactive. If you go back in time, we had no standards. We had nothing that anybody could look to under a broad range of circumstances. I mean, we've had everything from back when we used to have the wastewater treatment plant. We've had employees dealing with chemistry. You know, we have employees dealing as auto mechanics. So we have people that fit into a broad range of areas when it comes to OSHA level protection, but we really never had anything in place to guide us so that people could proactively say, okay, here's what we should do when the fire department, if there's some kind of chemicals, where do you look for information on how certain things should be stored? So that's basically, this is designed to be proactive, to establish some standards for us to operate. It wasn't designed to be punitive.
Okay. Thank you for that explanation, Mr. Guy. Thank you very much. Mr. Battaglia, did you have another thing that you would like to add to this, or you're good?
No, I think we're good. I think Mr. Guy already knows that obviously the state of Delaware has adopted many of the federal standards as the standards they go by, and that's usually what we follow as well, the Department of Labor. And that's where we report our injuries every year and things like that to the Department of Labor for the state of Delaware.
Certainly. Now, if you gentlemen would please stay unmuted so I can seek some questions and responses from my colleagues here. At this time, I'd like to introduce the Council President, Ms. Shabazz, if she has any questions or anything she'd like to comment on this legislation.
Yes, and thank you, Councilman Guy, for this piece of legislation. If I'm understanding correctly, are you saying it seems as though that we are doing the practice, but you are codifying the process to ensure that everything is the practice, and that the better things are happening for our employees? Is that my understanding, sir?
That's generally speaking a way you could describe it.
Okay, thank you.
Great. Do you have anything else, ma'am? Or
well, I guess what I'm thinking, I'm trying to digest his response to see if.
No problem. I can come back to you at another time, ma'am. Mr. Turner, do you have any comments or questions for the panel?
No comment, Mr. Chair.
Great, thank you. Mr. Johnson, do you have any questions or comments for our panel this evening on this legislation?
Just a brief question. Is there any, since this establishes a new board, is there a fiscal note attached to this? Any cost associated with establishing this new board?
Mr. Guy, did you want to address that question?
Okay, I thought that was Mr. Battaglia. Is there
either or? We'll start with you,
well,
Mr.
either
Guy.
or, yes. Yeah, if someone knows if this costs money, that's all.
I guess for starters, it gets rid of a board. It doesn't create a board. So if anything,
That's what I see.
if anything, it reduced costs, but I mean, costs aren't really an issue because the standards are the key thing that's in place. But the committee is actually being eliminated, not created.
Mr. Battaglia, do you have any comment on any, is there any additional cost or no cost to this? Or
I do not
negligible?
foresee, I do not foresee any costs as long as Mr. Guy is representing that, you know, what we're doing is just eliminating what he said is committee. I do have a concern though, because in both the 1102 and 320 contract, there is mention of a safety committee that meets every other month. I just want to make sure those two are not confused, and it's under the safety and health in both 1102 and 320. So that's something we may have to research. I don't know if we can circumvent a contract, a collective bargaining agreement that's already out there.
Any agreement through collective bargaining for a safety committee, that would still stand. That has nothing to do with this departmental committee.
Okay.
Yeah, Mr. Battaglia, I did not read the ordinance that way either. I read the ordinance as dissolving a committee and appointing an administrator similar to yourself in that role, that there would actually still be safety committees, I imagine by department, that would meet regularly on this. I did not read into it where this ordinance would cover such a thing.
Okay.
Yeah, I think Mr. Guy's pretty, this looks like simple and plain language, which we appreciate. Certainly.
Mr. Chair, and that was
Mr.
what I was.
Johnson, excuse me, Mr. Johnson has the floor there, Council President.
Okay, I'm sorry. I'm trying to raise my hand.
Sure.
Chairman, I don't have any further questions. Thank you.
Great, thank you, Mr. Johnson. Council Lady Shabazz, I'll be right back to you in just a moment, ma'am. Let me go give the floor to Mr. Friel if he has any questions, and then I'll get back to you.
I have nothing, thank you.
You're welcome, Mr. Friel. Okay, let's go around the horn again before we open it to the public. Council President Shabazz.
Yes, sir. Thank you. I finally got the clarity that I was trying to understand. My understanding that this legislation really doesn't change anything, but reduces what was not already happening, and making sure that what wasn't happening was appointed, a person was actually making sure that it does happen.
Got it. Understood. Mr. Turner, do you have any comments at this time, sir?
No comments.
Mr. Johnson? Mr. Johnson, do you have any comments? Do you need the floor?
No further comments. I have my question answered. Thank you, Chair.
No problem. Mr. Friel, you have the floor if you want it.
No, I'm good, thank you.
Great. At this time, it does not appear that we have any public individuals, but let me check with channel 22. Amanda, is there anyone from the public that's attending this meeting?
There's no one from the public, Councilman Adams.
Okay, great. All right, I'll tell you what, let's go back to Mr. Guy so we can close this up. Mr. Guy, do you have any closing comments? Mr. Guy? Okay. Mr. Battaglia, did you want to have any closing comments with regard to this?
No, I thank you for your time, and appreciate you allowing me to speak on it.
Certainly. Okay, if there's no public comment, I see no need to go back to my colleagues again. So at this time, I would ask that we have a motion to forward this ordinance to the full council. It would be ordinance 20-042, an ordinance to amend chapter 40 of the city code. Could I please have a motion to forward this to full council?
So
So
moved.
moved.
Second.
Yes. Okay, this ordinance has, there's a motion to move it and it's been seconded. Could, at this time, can we have a voice vote? All those in favor, please say aye.
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 Do we have any nays? Okay, sounds like this ordinance is unanimously voted out of committee and will be heard at the next available council meeting for this. I'm sorry, I did not check the calendar, but we'll get it listed as quickly as possible. Alrighty, that is the only thing on the agenda for this evening. Before we close, I would just like to make one quick public announcement. And that would be that I certainly hope that everybody goes out and gets their flu shot. It is the beginning of flu season. And so that is actually very important that we do that. I would like to note that West Side Health Community Center, which is at 4th and Scott, is holding free flu shots this Saturday, the 26th, and then 2 Saturdays in October, October 10th and October 24th from 10 a.m. to 1 p.m. Please understand that right there that those flu shots are free, no cost, and many other facilities such as CVS, Walgreens, and many other ones do provide flu shots for you, as well as the clinic on North Miller Road here in the city. So if you listen to the CDC and others, they tell you the flu shot is safe and you should go get it. And so please do that.
Here, can I interrupt you for a second? Just to let you know, any
Sure.
city employees, the medical dispensary is also giving out free flu shots. We'll give them out until we exhaust our supply, which is 350 flu shots. We normally do about 270, so we have 350 for city employees.
Terrific. Thank you, Mr. Victalia. That's wonderful. So if you're a city employee, run on down to the dispensary and get your flu shot. And hopefully you'll bring your family members and go someplace else and get it too. Do any of my colleagues have any other comments before we close? Great. Could I have a motion to adjourn then, please?
So move.
That's right.
Great. Okay, we had a motion to adjourn and seconded. So hey, with that, I'll close the meeting and say thank you to everybody involved. Certainly, Mr. Battaglia, thank you for your time. Everyone have a real nice evening.
Thank you. Have a nice
Thank you.
evening.
Take care.
Bye-bye.
You too.